This is Duke University.
Hello, my name is Andrew Muir and I'm a hepatologist at Duke University in Durham, North Carolina. I take care of a lot of patients with hepatitis C, and I find that first visit for a new patient is often pretty challenging. There's a lot of information we give them, and for some folks it can be quite overwhelming. So we wanted to put together this little video of just the 5 things I hope you take away from that first visit for hepatitis C. Number 1, hepatitis C can be cured. This is often a surprise to people. They think maybe we're just trying to get them in remission or get under control. But hepatitis C can be cured, and that should be our goal. When you're thinking about the therapies that you might want to take, I want you to remember why you're doing this. Let's get rid of it for you so you can move on. Number 2, hepatitis C treatment is very effective and well tolerated. In the past, you may have heard about a medicine called interferon alpha. This was an injection that caused lots of side effects and worked moderately well. But now we have pills, we have no more injections, and these are very well tolerated. In the studies that have been done and in my clinical practice, these medicines have really minimal to no side effects. And when we've looked at and researched about different patient groups, over 90% of most groups have been cured when given these medicines. So we can offer you a very highly effective therapy that won't cause great impact on your quality of life. It's not a guarantee, but it's pretty close in medicine, so we want you to consider treatment for it. Number 3, you want to know how much scarring you have in your liver. You want to know the stage of your liver disease. It's not just having the hepatitis C virus that's the issue, but when you have it and it causes damage to liver cells, the repair process in your liver leads to scarring or fibrosis. And you want to know how much is there. And you really want to know if you have cirrhosis. Now when I say cirrhosis, people often think I'm talking about alcohol. But this is, with any liver disease, you can get cirrhosis, and it's really how much scarring that you have. So you want to get that assessed, and there's a number of ways that we can do that for you, and we can guide you about that. But the key is you want to know what it is, because we might monitor you differently if you have cirrhosis. We're still going to recommend treatment, and treatment is highly effective in patients with cirrhosis, and it can stop you from progressing any further than where your liver disease is now. Number 4, we want you to practice liver wellness. You already have hepatitis C, and we otherwise want you to take great care of your liver. One of the key issues that comes up often is alcohol. And we've been unable to find a safe amount of alcohol to drink for patients with hepatitis C. So if you do drink, we're going to want you to think about stopping completely. If you're not ready for that, or if now's not the right time, I at least want you to think about cutting down so we can work towards that. If you're overweight, you're also at risk for fatty liver disease, and so we want you to address that. I want you to think about a diet and an exercise program that will get you to have a body mass index of less than 25. There's no specific diet or exercise program I recommend. The key is the one that works for you, and you may need to try several to find the right balance. If you have diabetes, you're also at risk for fatty liver disease, so if you do have that diagnosis, we want you to work on getting great control of your glucose. Number 5, I want you to get your vaccines. So we'll let you know if you've been exposed and already protected against hepatitis A and B, but if not, then we'll give you the vaccine series for that. I also want you to get your annual flu shot, and if you have cirrhosis or if you're over 65, I want you to get the pneumococcal vaccine. The key here is that patients with hepatitis C are at greater risk of complications from these infections. So let's get you vaccinated so you can be protected. So those are the 5 major things that I want you to remember, and also I want you to remember to be hopeful. I know that hepatitis C is a major challenge, but we now can help you with it, and we have highly effective therapies. So let's get you in the clinic and talk to you about that in more detail. Also, if you don't have hepatitis C, then I want you to think about whether you might be at risk for it and get tested. Please recall that there is now one-time testing recommended for everybody who was born between 1945 and 1965. Most cases of hepatitis C in Americans are in people born between these years. And most of these people feel very well and don't realize they may have it. So even if you feel well but you fall into that age group, please get tested. If you do have it, then please come see us in clinic and we'd be happy to help you. So thanks for your attention, and again, if there's anything we can help you with regarding hepatitis C, please let us know. My name is Andrew Muir, and I'm a hepatologist at Duke University in Durham, North Carolina. Thank you very much.